I think we have great partners in the community, and we have great leadership within the organization. And so this is an opportunity for us to act on those things that we've already been doing, right, for over the last several years in prioritizing racial equity and just acting with more urgency in order to address some of those root causes.
BIPOC stands for Black, Indigenous, and People of Color. And the numbers are telling us that they're disproportionately impacted. So here in Bloomington, we see about 20% of our cases are in the Black community and a little bit higher in our Hispanic community.
That means about half of the COVID-19 cases in Bloomington are in the BIPOC community.
Part of the reason that's startling to us is because the BIPOC community makes up about 28% of our population. And so we're seeing significantly more cases in the BIPOC community than we would expect based on our actual demographics.
So institutional racism is the systematic distribution of opportunities and resources for some, for whites, and at the exclusion of Black, Indigenous, and people of color. And unfortunately, our country was created on this model of institutional racism. And so for a really long time, everything from where you live, what job you could have, who you could marry, what type of health environment you live in, all of those things were dictated based on race. Now, about a little over 50 years ago, we saw some progress in that area with the civil rights movement, and there were laws that were put in place in order to mitigate some of those circumstances. But what we see, especially in light of a pandemic like this, is that the legacy of those centuries of institutional racist policies, right, they have a lasting impact. Racial inequities create racial disparities. And racial disparities is just a word that means that the way that people live is different based on their race. And so the city of Bloomington is not unique in that way. Similar to the state of Minnesota and the states across the country, we have very significant racial disparities in our community in all aspects of well-being. So we have racial disparities in housing, in education, in income, and all of those different areas. And those disparities are a threat to the success of our community.
The success of a city really depends upon the weakest link. And what we see right now is we see a disproportionate impact on many aspects of many members of our BIPOC community. And so as our city continues to grow, we have many members of our community that do not have access to their full health potential, their full well-being. And so as our demographics continue to shift, we're continuing to see our community become more diverse every year. And as that continues to change and that diversity just adds so much value to our community, we're also seeing many members of that community are not as healthy or well as they can be. And so they can't live up to their full potential from a health and well-being standpoint. And because of that, they can't contribute to the full vitality of the way our city is growing.
The other reason why this is really important for the city of Bloomington in this moment is because there's sort of a global awakening, right? And sort of an acknowledgement and understanding of these issues. And while I must say for me, as someone who's been involved in this work for a really long time, I'm both excited and frustrated at the same time. But I think that there is, right? People who are starting to pay attention, and there's a new understanding. And the city of Bloomington can use this moment as an opportunity to really move forward on some of the work that we've been wanting to do for a really long time.
And continuing work that is already being done, like community partnerships to deliver masks to BIPOC communities and messages from city leaders like the mayor and police chief.
This global cry that I speak about really came about with the death of George Floyd that happened right here, in our community. Minneapolis isn't that far away. And so in responding to George Floyd's death, the city of Bloomington has done a number of things to demonstrate our commitment to moving this work forward.
And finding ways to help our neighbors.
One of the other things that happened right away is that the city of Bloomington community really rallied together to show support for our neighbors in Minneapolis and St. Paul. And so Councilmember Jenna Carter and Bloomington Leadership Program alumni Laurie Aho really that weekend came together to create this donation drive. And within 4 hours, they had 3 cars filled up with donations that were distributed to 5 sites in both Minneapolis and St. Paul.
The city's community outreach and engagement team has continued that work with donation drives for Minneapolis.
And so essentially, in the middle of a global health pandemic, which in a way requires us to be separate, there's this global push for us to become more connected. And so right now, the city of Bloomington is working on plans for how do we go about and be intentional about mitigating the health concerns of COVID-19.
The city has provided language translations and specifically reached out to BIPOC communities to relay critical health and safety information about COVID-19.
We will continue to do the things that we have done, continue to prioritize racial equity work. In addition to that, we will act with urgency to really tackle those immediate needs, and we'll be thoughtful and intentional about building a plan that leads us to a place where we are that city where people of all races are able to thrive.